Welcome to Maison Dental. I'm Dr. Glafira, and for today's video we'll be talking about dental x-rays. What are they? They're black and white images taken of your teeth, the jawbone and the surrounding tissues. The types that we might take at the dentist include a Bitewing, which shows both the top and bottom teeth, a Periapical radiograph, which shows the crown as well as the root of the teeth, and then there's the OPG, or the orthopantomogram, which shows all of your teeth, the jawbone, your sinuses, as well as a bit of your skeleton. There's also the cone beam CT scan, which may be taken for a few of your teeth or all of your mouth, and it's a 3D image of the teeth, but we'll talk about that another time. So why do we need to take x-rays? I wish I was Superman and had x-ray vision, but unfortunately I'm not. So x-rays help us to diagnose decay in between the teeth, underneath old fillings and crowns which we can't see with our naked eye. It also shows us the bone level in between the teeth, which might indicate gum disease, and also it can show calculus, which may be building up in between the teeth and causing gum disease. Periapical radiographs are taken to look for any signs of disease around the teeth and roots. A radiolucency at the tip of the root might indicate that there's an infection inside the tooth, or there could be a cyst. We look at the anatomy of the root and the canals within, which is important for certain treatments, and we also look for any changes within the structure of the teeth. An OPG gives an overview of your mouth. The machine spins around your head for about 15 seconds, and when you take an OPG to see if there are any lesions within the jawbone, sometimes we'll see an extra tooth, cysts, and wisdom teeth. And what about radiation? At Maison Dental, we only use digital x-rays, and these have a significantly lower radiation level than traditional x-rays. For example, 2 of these are equivalent to 1 day of background radiation, and an OPG is about a quarter of the radiation that you'll receive on a flight from Sydney to London. So how often do we need x-rays? Generally, we take Bitewings every 2 to 3 years to monitor old fillings, crowns, the bone level between your teeth, and also to look out for any new caries lesions. If you're at high caries risk or have small lesions that need monitoring, they may be taken more frequently. OPGs may be taken every 5 years as a general screening and to look out for oral cancers. So how does it work? We use photo plates which come in different sizes. The smaller ones are for the kids, the larger ones, this is generally the normal size that we use, and they're quite thin and comfortable. We put it inside the mouth. It is then processed through this machine, which reads and processes the image, and then voila, there's your x-ray. Hope that made sense to you. If you have any questions, make sure you ask your dentist.